Physical inactivity is an important problem. In Australia, 1 in 2 adults and 3 in 4 children are not active enough for good health, meaning that most Australians are at risk of developing chronic disease. Australia has committed to addressing this. It signed up to the WHO target of reducing physical inactivity by 15% by 2030. A key part of understanding how we're doing in achieving this goal is by monitoring the behaviours of how many people are being active and the environments in which they are active. There are 2 main things we'd like to discuss with you today. First of all, we'd like to understand how you are measuring and monitoring physical activity behaviours and environments. And we'd also like to have a blue sky, off-the-record discussion about what you think should form part of a comprehensive physical activity surveillance system. What are the things that we should be measuring across a range of sectors and agencies that would help inform a more comprehensive national approach to this issue? We're having discussions like this with other states and territories to see if there is a common or a minimum set of indicators that we can recommend. We're not in a position to implement any recommendations, but we're hoping to bring together in a de-identified way the various information and perspectives shared in these meetings to feed back some broad guidelines that will hopefully help build a more informative and standardised physical activity surveillance system. We have done some work to understand how physical activity is measured by the states and territories in their population health surveys. What you see here are estimates of the proportion of the adult population meeting guidelines as reported by each of the states and territories, except for Northern Territory, which doesn't have their own monitoring system for this issue. Some jurisdictions have numbers against their trend lines, and these represent points in times where they change their questions or their definition of meeting guidelines. What this graph shows is a great deal of variability between jurisdictions and fluctuations over time. But this variability and these fluctuations cannot all be attributable to that jurisdiction's policy or program settings, because in this graph we can see from the state-based analysis of the National Health Survey that the jurisdictions are more similar than the graph on the left would suggest. What we'd like to understand through the discussions we're having with each of these states and territories is whether we can achieve greater standardisation of physical activity measurement in health surveys that would allow for greater comparability between and within jurisdictions over time. Let's take a moment to zoom out a bit and consider the broader physical activity system. What you see here is a conceptual systems map that we developed to provide a big picture reference for how to think about the multiple influences on physical activity. So in the centre, in the black square, is human movement or physical activity. Around this, in the dark blue, are the core influences on physical activity, such as individual psychology, physiology, demographic status, and the social physical environment and norms. Moving out another level, in the light blue, we have 8 intervention points across the system, which are known as the 8 best investments for physical activity. On the far left, we have elements in dark green, and they remind us of the macro elements that support or hinder actions on physical activity. And in the far right, in the light green, we have elements around governance and knowledge mobilisation, which is where surveillance systems fit. If we pull out the surveillance systems component, we can see more clearly what it links to. Surveillance is of course linked to physical activity, the black box in the previous slide, not shown here, as well as the core elements of demographic status, social and physical environment, and social norms. There are direct linkages to each of the 8 intervention points or the best investments, so we can understand what is happening in these areas. Surveillance is also linked to the legal and policy environment. For example, what do laws cover? Are they fully implemented? And it contributes to the knowledge environment, allowing multiple sectors to gain insight into what each other is doing to progress this issue. And finally, for obvious reasons, surveillance is linked to governance, transparency, and accountability. It helps us to understand whether we are on track to meet our goals and targets and the level of engagement or investment across the system intervention points. Let's pause for a second and consider a surveillance example outside physical activity, in this case tobacco. The WHO Framework Convention on Tobacco Control is an international treaty which sets out key agreed actions on this issue. The actions which deal with demand reduction measures are described using the acronym ASAPa, which is shown in the image. Importantly, the first letter M stands for monitor, meaning monitor tobacco use and prevention policies. To give effect to this agreed action, the WHO, member states, and key international organisations have developed the GTSS, otherwise known as the Global Tobacco Surveillance System. This image shows the status of the ASAPa tobacco control policies in the world. The surveillance system provides a very high-level view of policy implementation across the world. For example, it shows that around 40% of the parties to the treaty or signatory countries had complete policies on monitoring, M, and on warning labels, W, whereas only 13% had cessation or quit programs. You can see here that a number of reports have been developed over time, drawing on data from the Global Tobacco Surveillance System and focusing on a particular element of ASAPa. So in 2009, the report had an emphasis on the implementation of smoke-free policies, whereas in 2015, the emphasis was on taxation and raising the price of tobacco products. The surveillance system allows the generation of this graph, which shows the growth from 2007 to 2016 of countries with at least one tobacco control policy implemented at the highest level. And you can see that while it started at 42 countries in 2007, this increased to 121 in 2016. It's important to note that only a comprehensive surveillance system allows us to see progress as well as gaps across the portfolio of actions. This means designing a system which monitors policies and implementation, and not only individual or population level knowledge, attitudes, and behaviours. So does such a comprehensive surveillance system exist for physical activity? There is a leading example in Canada. Since 1981, a non-government organisation has been funded by the Canadian federal government and by the provinces or states and territories to carry out national and provincial level physical activity surveillance. This non-government institution, known as the Canadian Fitness and Lifestyle Research Institute, is a small funded organisation that monitors physical activity and its antecedents. Throughout the year, it produces reports, policy briefs, and community fact sheets. Initially, the Institute developed a framework for physical activity monitoring, which you can see here, and they built a surveillance system which comprises surveys every 3 years of schools, workplaces, audits of the built environment, as well as measuring the social and economic consequences of physical activity. This is in addition to a routine physical activity survey which has included objective pedometer measurement of representative samples of Canadian schoolchildren. This system continues to be funded by all provinces and the national government, who jointly value it for physical activity and for sports sector surveillance. So we hope that's provided you with some useful background and maybe some inspiration for our discussion today. Thank you for listening.